Now, we all know, don't we, that the NHS needs to reduce its costs, but it's important that the quality of the health service isn't compromised in the process. GHX connects hospitals with their suppliers to ensure that the NHS receives the right products for patient care at the right place and at the right time. As Sharon Thomas explains, taking learnings from other industries and enhancing transparency in the healthcare supply chain can increase efficiency, remove uncertainty, and improve patient safety.
All of us will be patients at some time in our lives. Most of us take for granted that the equipment needed for our treatment will be available when it's needed. Having electronic tracking systems means healthcare providers have the right products at the right time for the right patient. The Leeds Teaching Hospital NHS Trust is one of the largest in the UK, with a turnover of £1.1 billion. It uses 20,000 different products of varying quantities in its patient care. Real-time end-to-end tracking allows hospitals to optimise inventory levels and lower costs, increase patient safety and release more time to care. The Trust has one of the largest cardiac intervention centres. Serving a population of nearly 5 million for specialist services, it's pioneering a new approach to tracking products used in patient care called Scan4Safety, which will save clinicians time and the NHS money. For many cardiac instruments, the journey starts here. B. Braun Sterilog, based in Pudsey, West Yorkshire, decontaminates and sterilises 1 million medical items each year and returns them to hospitals. The company uses a track and trace system to monitor items through the process. Items are barcoded and sent to hospitals, and that barcode can then be linked to an individual patient, guaranteeing full traceability.
When you're working on this kind of scale, the use of an effective track and trace system is imperative. We need to be able to trace an instrument set back to a member of staff, back to a process step, a process cycle, and ultimately the patient. So without an effective track and trace system, we would lose significantly in terms of efficiency and cost.
Around the clock, medical supplies, such as those from B. Braun Sterilog, are replenished to hospitals right across the globe. By harnessing technology similar to that used in retail, each of these items can be tracked and traced from source to arrival here at Leeds General Infirmary to patient. Barcodes allow products to be identified by everyone in the supply chain, meaning all have access to the same vital information. Leeds has worked for many years with Global Healthcare Exchange, known as GHX, to share this standardised data among the multiple organisations providing the products used in patient care.
GHX works to reduce healthcare costs by automating business processes. And through that automation, we can capture data electronically that helps us understand how to improve the quality and safety of care. Patient care is delivered locally, one patient at a time, but we need the use of global data standards, GS1 standards, to identify products, places, and patients in order to have accurate data to make better decisions.
The NHS faces the escalating pressures of doing more with less, not just here in Leeds, but throughout the UK. This is all whilst balancing finite resources with an ever-demanding and ageing population. Removing costs from the supply chain can improve operational efficiency and alleviate some of these pressures.
We place about 60,000 orders a year, so if you think about what I was saying around the cost of processing those orders being about £75 per order, we're now down to pence. It's about ensuring we release as much clinical time to the patient rather than having clinicians involved in supply chain operations. What we want to ensure is the products are in the right place at the right time, so when the clinicians want them, they hold out their hands and the products are there. It's actually ensuring that if they use a product today, it's back on the shelf in the morning.
The Leeds Teaching Hospital Cardiac Department performs more than 2,500 cardiac intervention procedures per year. And it's very important that we get the right equipment, track them correctly, and after the patient is discharged, we know where these equipments are.
The Scan4Safety project is about delivering safer and more efficient care for patients and a cost-efficient service for the NHS now and into the future.